Because you kill off the natural flora in the bowel, you grow fungus. The fungus leads to high permeability in the gut membrane, so-called leaky gut syndrome, which leads to more things coming through the gut too fast, which leads to creation of type G antibodies against the foods, which when the foods come by leads to inflammation, which leads to sinus congestion, which leads to more sinus inflammation, which leads to more sinus infection, and then you take more antibiotics, and it's a vicious cycle. It's a vicious cycle. All right, I'm kind of getting back to Dr. Paul's look here at classifying disease, and there are 9 accepted paradigms for diseases. We have the genetic, we have infections. Okay, so genetics are blueprints were a problem, okay? You can think of Down syndrome, for example. That's a common one we see. Infections, we can think of funguses, parasites, bacteria, viruses. Nutritional deficiencies, classic ones, beriberi, pellagra, rickets. Hormone dysfunction, you get these kids being born with no thyroid glands, you know, sure. Allergies, we know about sneezing and wheezing, dripping and itching. Autoimmune processes like lupus and rheumatoid arthritis, cancers. Poor circulation of oxygenated red cells there because of atherosclerosis, strokes, heart disease, and amyloid deposition. So these are accepted paradigms in the medical world. And so Dr. Paul comes up with this little thing, and I won't get into the details there, but he pronounces that no ono. No ono. Kind of cute. What's this new model of disease? And basically he's saying that this nitric oxide peroxynitrite reactions are associated with inflammation. And he says that the presence of certain stressors at the right time in the susceptible individual will initiate a positive feedback loop involving nitric oxide and peroxynitrite. And the loop sustains inflammation. It kind of reminds me of what I just talked about sinusitis and how you get a downward spiral. Well, this is another thing where you get this vicious cycle going that continues to feed on itself there. So beginning with a stressor, well, I won't go through the details here, but this is, you can just look at that. He's got a mechanism now for this. All right, excessive nitric oxide leads to too much peroxynitrite, oxidative stress, NF-kappa B transcription factor activity, inflammatory cytokine activity, inducible nitric oxide synthase activity, leading again potentially to excessive nitric oxide, and the circle continues. And this vicious cycle continues with increased amounts of inflammation, disrupting the body, and something happens and we call it a disease or a syndrome. But you see, we're trying to get behind the scenes here and say what's going on in this inflammatory process. So the end results that depending on the triggers and the susceptibility of the person, we have different manifestations of this underlying inflammatory process. And we may come up with a name we call chronic fatigue syndrome, fibromyalgia, and so on, depending on how it expresses itself. So if you want a deeper understanding of the process, check Dr. Paul's book out. Just came out recently. Some of it's technical, if you like technical stuff. Some of it's very readable, and a helpful little handbook there. Okay, what's the point? What we talk about as poorly explained conditions like fibro, in fact, may after all have a defined mechanism, which when understood provides clues to safe and effective treatment strategies. And if you remember that cycle we talked about, one specific strategy is to find the stressor that set off the cycle and get rid of it. Okay, what are the stressors? Well, certain stressors have been clearly documented in terms of setting off these cycles of inflammation. And I've grouped them up there on the screen. And I'll go through them with you. And again, it depends upon the susceptibility of the individual. We can have infections, such as viruses, toxoplasmosis, and bacteria. There might be physical trauma. I have one patient who was in a bad car accident, and that's when it started. There may be chemical exposures. And interestingly, these can be acute, high level, like the chlorine tank broke when I was at the picnic at the beach, you know. But very importantly, the multiple low-level exposures can be at times more significant. We have people working in offices with high amounts of new carpeting odor, colognes and perfumes, cleaning solutions that have been used on the countertops. And they're not hugely high levels, but that little bit, day after day after day after day, can at times be worse than a sudden acute exposure. And the exposure could be to pesticides and solvents and other volatile organic chemicals, VOCs. Sometimes there's strong psychological trauma, and we'll talk more about the psychological factors as we go along here, but that in itself sometimes will set off the physical problem of this peroxynitrite cycle that we talked about. Ciguatoxin is a fish poison that in cases have set this off. Carbon monoxide exposure can be important, and of course we can find that in poorly ventilated spaces where there's combustible material burning. Thimerosal exposure, start getting into this when we think about the vaccines and other medications that may use that mercury component, okay? And there's other possible stressors, some of which we talk about, including mycotoxins, mold toxins, molds, and then what might happen in a major surgery. Okay, if we just think of those past mechanisms and say, well, what's going on with fibromyalgia? Typically genetics plus infection plus physical trauma. And then I would add in nutritional deficiencies, allergies, and hormonal deficiencies commonly showing up. How does this model relate to medications? Well, if we treat symptoms alone without dealing with this cycle of inflammation, impacting this positive feedback loop of nitric oxide peroxynitrite, we can be sure that we're only getting partial value or just doing part of what's going on. And again, relieving pain, improving energy is generally helpful, usually, whatever the mechanism. And the antibiotics and sinusitis is an exception. There might be others too where you get side effects from a particular drug. But, so getting the symptom control, improving function is good. If we can get behind the scenes, that's better. Is there a rationale for treating fibromyalgia and other unexplained illnesses with medications if we follow Dr. Paul's model? Well, here's an example of 3 different ones. Paxil, the antidepressant there, may lower the nitric oxide synthesis. Minocycline, the antibiotic, can work as an antioxidant and pick up peroxynitrite. Astelin, the nasal antihistamine spray, can lower the NF-kappa B activity. So these are some examples where medications may play into in a helpful way. All right, so we've talked about the general concept of fibromyalgia, management goals. We've talked about Dr. Paul's book on unexplained illnesses. What does environmental medicine offer? That's the model that I work with. And again, my approach is integrative care. So we include medications in our work, but also look at other things. And before looking at non-pharmacological measures, let me state again that certain medications impact this cycle of inflammation and can be helpful. And dealing with symptoms with medications can just be a helpful thing. All right. The environmental medicine model presses us to resolve the underlying disease process and thereby indirectly gain control over symptoms. So there's a number of things we'll go through in more detail there, but staying away from pollutants, solvents, perfumes, pesticides, mold, mycotoxins, staying away from these things, correcting the nutritional deficiencies, desensitizing for allergies and sensitivities, helping the body detoxify better, replacing and balancing hormones, promoting autonomic nerve function and balance, improving digestion and absorption, overcoming chronic infections, and removing toxicities. All of these steps work to relieve the underlying inflammatory state. I keep saying more on that later. Well, just hang around. Oh, wait. Isn't this all really in your head? Oh. Why is it so important that fibromyalgia, chronic fatigue syndrome, and these other chronic conditions are not labeled as psychiatric, psychological, psychosomatic, or somatoform disorder? This labeling is very popular. Very popular. I see a lot of folks with fibro, chronic fatigue, chemical sensitivity, very popular to say, it's very convenient, by the way. It's an easy way out. You can get the patient out the door quickly. You can not have to deal with any of the environmental nutritional issues